I'd like to welcome you to our webinar, Tipping the Scale, a modern guide to managing feline obesity. Dr. Ward and I were just talking about the issues. It's not just an appearance thing. It does have serious repercussions. So I do want to, if you want to go ahead and do the next slide real quick. Go back one. Okay. Okay. All right. So one thing I want to announce that I want to talk about just real quick is, I'm going to put a link into the chat. Right now, we just started something called Joey's Ride for Cats. An actor director from California is actually riding a one wheel across the United States from California to Maine. And his goal is to raise $1 million for cat health, for every Cat Health Foundation, specifically for feline CKD and feline cancer. So I'm going to put a link to donate in there, but you can also visit our website. You can visit our social media to learn more about it. But he's doing daily updates on his trip, and it's kind of fun. It's really exciting. He's quite the character. So, all right, enough said on that. I'm going to go ahead and turn it over to Dr. Ward, and we're going to learn about managing feline obesity.
Gosh, thank you so much, Anne, and I really appreciate this opportunity. Thank you to Every Cat for all that they do. They do some tremendous work really around the world as far as forwarding progress and solutions for some very serious diseases. And so again, we'll have a link in the show notes and the Q&A and the chat where you can follow along with that guy riding a one wheel across the country to raise $1 million. That's pretty impressive. Today, we're also going to talk about something that's pretty serious and near and dear to my heart, and that is feline obesity. And so for me, when I look at all the issues affecting dogs and cats and horses and rabbits and small mammals and birds around the world, obesity is one of the top challenges that we face. And again, today we're going to kind of lay out the current stats as far as the United States goes. We're going to talk to you about some of the causes of obesity because it's much more complex and really much more of an issue than just overfeeding and under-exercising. And so we're going to talk to you a little bit about the science of that, and then maybe some practical tips and advice for how you can help your cat maintain a healthy body condition. This is airing right now during the middle of the World Pet Obesity Week. And this is something we've been doing now for 20 years. On the screen right now, there's a couple of QR codes. And the most important one for you is to take our survey. We really need your insights. We need your thoughts and opinions on pet foods, cat foods, obesity, future solutions. This survey only takes a couple of minutes, and I will say it is probably the most anticipated and acted upon survey in the vet industry. So all of the major pharmaceutical companies, food companies, all the people that are developing technology, they look to you to say, where are your real pain points and how can we address them? So if you get a chance, just snap the picture here, take this QR code, and then take the survey and share it with your friends. If you also go to the website, if maybe you have a rescue organization or you're a veterinarian working in a clinic somewhere or your shelter or whomever, we do have a whole toolkit for you to do with shareables, copy and paste things. Again, if you just go to petobeసిtyprevention.org. Right here, the second one is actually takes you straight to a to a newsletter sign up. So I'd really appreciate your help in getting the word out. All right, so let's talk a little bit about some of the issues with obesity in cats. And that's all we're talking about today. There's a lot of other species we work with. At the association, we typically work with horses, rabbits, dogs, and cats, but we also do some other stuff around the world. But when we look at obesity in cats versus dogs, for example, we do notice that there is a difference in the way the world portrays them. And by the world, I mean, let's focus on English-speaking world, the UK, Canada, and the US purposes of the study. And so one of the things that we did a couple of years ago was we went and analyzed social media posts around feline obesity. So we did use TikTok. We also did a little bit with Instagram, but TikTok is very easy from a searchable database. So we were able to get access, and we just kind of looked, and this was from January of 2024. So this was published in February, March of 2024, and I think it still holds true to the large extent. But what we wanted to do was see what terms, what hashtags, what types of content were being produced around dog versus cat obesity. And we found, really, I kind of summarized it in the title, Fat Cats and Greedy Dogs. And what we looked at was, again, those terms and the comments that were made underneath a video, for example, on YouTube and TikTok were our big ones, and Instagram, tertiary. And we found that anytime a cat with obesity was portrayed, and a lot of times these were in a comical setting, so people were like making fun, like, look at my cat, she can't move around, or look how much my cat, he likes to eat, right? The comments were undeniably and overwhelmingly positive and humorous in nature. Now, then when we evaluated posts with dogs with obesity, or people making a joke about my dog eats so much or my dog won't go for a walk, we found the opposite effect. We found that people were very critical of those comments and made judgments on the pet parenting abilities on dogs with obesity versus cats. So you can already see there's definitely from a social media perspective, and I would say from a cultural vantage, that there's a discordance between how we view cats with obesity versus dogs with obesity. In cats, it's more accepted. It's kind of a normal, it's a funny, jokey thing, right? Whereas in dogs, you're a bad dog parent, right? There's a lot of condemnation. So it's very interesting. If you get a chance, you can check it out. We have the raw paper on the website. Again, Fat Cats and Greedy Dogs. If you look under articles or newsroom or things like that, you'll see sort of that, but fascinating findings for sure. Now, let's take a picture here of a cat. Now, this is a British short hair, which obviously does have some genetic predispositions for obesity, but obviously this cat definitely has obesity. And I always use this illustration to explain sort of the differences in perspective. So that cat owner who has this cat, they think they have a big cat, right? To them, they've got the Shaquille O'Neal of cats. This is a cat that would be in the major leagues, the National Football League. It would be a star athlete, the biggest, right? So they don't quite see it as obesity yet. Now, a veterinary professional is probably going to say that cat clearly has obesity, probably a newer term that we use called clinical obesity. So they would say, okay, we get it. This cat is not just big, it actually has an unhealthy body condition we would characterize as obesity. But I want to reshape your lens just slightly. For myself, as a veterinary professional, I actually see inflammation. And I think that should sort of kick off today's discussion, meaning that it's not an aesthetic. This isn't appearance. This isn't just, a funny thing. There's actually systemic inflammation affecting every cell, every process in this cat's body, right? 24/7, 365, it is under assault by harmful cytokines, okay? Now, these cytokines, or adipocytokines is another term that we use. These are being harmful chemicals, compounds, they're hormone-like molecules that actually are secreted by fat tissue. And this is why you'll hear physiologists and veterinarians like myself refer to all that excess body fat, the visceral fat in the abdomen, the belly fat, as the second pancreas, because it's so biologically, hormonally, chemically active. It's like a pancreas. It's secreting all of these hormones. Now, if we go back and we go to Koppelman's first definition in the literature, and this goes back to 2000, and this was in Nature. So this was, again, the preeminent biology, publication in the world, respected by all. And Koppelman's was the first one who begins describing in very strict scientific, medical, biological terms what obesity is. And Koppelman's words, again, these are just things that I took to heart and live by, but obesity is a disease, and this was the first time that people use that term. A disease in which excess body fat, that's why you keep hearing me say body condition and body fat and visceral fat, in which excess body fat accumulates to the point where health is adversely affected. Now, this succinct, elegant definition has stood the test of time. This is now 25 years on. Koppelman is still correct, and everybody still adheres to this definition of a disease in which excess body fat causes adverse health impacts. I mean, that is really sums it up. Now, we've got an emerging, constantly growing body of literature in cats only. Now, I could show you similar lists for dogs and for horses and for rabbits and even some of the minor species, right? So this is clear evidence that in cats, these are all of the ones that, hey, nobody's going to disagree with. Diabetes, GI disease, hepatic lipidosis, or fatty liver syndrome, which is actually a lot more complicated, especially when we look at in some of the newer nomenclature for how we describe liver disease in humans. So again, not just fatty liver, but actually a metabolic alteration due to adiposity. High blood pressure, a lot of arthritis and musculoskeletal disease in cats, many forms of cancer, again, directly linked to excess body fat. Eye disease, oral disease, skin disease, right? Upper and lower urinary tract conditions. I mean, we could go on and on. There's also, some emerging evidence with kidney disease in cats. It's clear in dogs and humans. And again, we're just now accumulating enough evidence to say demonstrably, unequivocally, that it's affecting cats as well. So this is all, this is not for debate anymore. We also know that cats with obesity, especially those that are on a body condition score of 9 out of 9, and we'll give you some more insight into that if you're not familiar with body condition scoring. But those cats that are at the farthest reach of obesity, they have shorter lifespan. And again, this is back to Ting's stuff, and this was in 2018 and 2019. And so, again, accumulation of evidence showing they live shorter life expectancies. Now, if you kind of want to go through an exercise with your own cat, you can go to petobesityprevention.org. And again, all these tools are free. This is why we have this organization for 20 years now. And you'll see a variety of body condition charts. And so that's a great start. We actually will walk you through the steps you need to do with your cat, what to feel, what to look at, and sort of guide you. And you can get a pretty good assessment of your cat's current body condition. And again, we really are focusing on excess fat, particularly around the abdomen, the belly fat. Okay. So again, I encourage you to take a look at that. This is a slightly more detailed. We have a couple of versions of these body condition charts. This one's actually made for our veterinarians and veterinary professionals who use this on the daily. A lot of them are going in with their tablets and phones and just using these charts as a bookmark and saying, let's take a look. We also, again, as I mentioned, there's sort of some flows, some algorithms that you can walk through with your cat to determine its body condition. But again, none of this replaces your veterinarian's actual physical exam, because not only are we doing a body condition scoring, but we're also assessing muscle condition. So there's a lot to this, but again, I encourage you to look at it. Some of the current data, again, every few years we do these nationwide prevalence surveys. We've now expanded that internationally. So we work with groups all around the world now to do these types of surveys. But based on the latest data from the US, about 61% of cats in the United States were classified by their veterinarian as having obesity or overweight. Okay. And then of course, there's a lot more stuff to it. They try to help them lose weight and they aren't successful. Again, they say the vet doesn't discuss obesity with them enough. I mean, there's a lot of these surveys, and I encourage you to go back, and if you have some time, just kind of look through some of these survey results, because again, over 20 years, we've accumulated quite a bit of data. I like to look at this, though, chart more importantly, because we say 61% of cats were classified as overweight or having obesity by their vet. But I'm focusing primarily on the obesity end of that spectrum, right? This is a cat that doesn't just need to maybe drop a couple of pounds of extra fat. This is a cat that maybe needs to drop 4, 6, 8, 10 pounds of excess body fat. And so when we look at that figure, you can clearly see this is where we're losing. About a third of those cats that were classified as overweight or having obesity, a third were clearly in the obesity category. And that means these are cats that are at tremendous risk of developing diabetes. I mean, that's really kind of just the start of it. I mean, obviously we mentioned high blood pressure, skin, urinary tract, I mean, cancer. I mean, there's that whole list. But again, when I see a third of the cats that vets are seeing and they report them as having obesity, that's alarming, and it's something we can do about. Okay. So when we ask pet owners, dogs and cat owners, in our last year's survey, and we'll ask you this year too, so please take the survey. It only takes a couple of minutes and share it with your friends. If you love cats as much as I do, share it with your friends. We need more cat data. Every year, we get an overwhelming surge of dog responses, and then it's like a third of our responses, a fourth, or a cat. So I need more cat people, so please help us out, share it. This survey is it's open until December 31st, right? So obviously right now is an awareness week campaign, but we keep this survey going for as long as we can to try to accumulate as much data as possible. But we asked them, hey, cat owners, are you familiar with body condition scoring? And you can see in the US, only 40% of cat owners said, I know what a BCS is, and yet 45% of dogs. And we do believe that veterinarians are doing a slightly better job at educating the public or pet owning public about body condition scoring in dogs, but we have a long ways to go in both, but certainly in cats. And then we say, okay, cat owners, how do you categorize your cat's current body condition? And we asked that again this year. And about half, 55%, say, hey, my cat's in an ideal, healthy body condition. And of course, sadly, we know that doesn't match up. When a vet looks at it, they say 61% are overweight or have obesity. And you can see here only 33% or a third say, yeah, my cat might be a little tubby. So we got to do a better job, just all of us, in communicating. And again, when we ask them about this, do they have obesity, overweight? A third, 35%. So we've got some gaps there for sure. Now we do compare. 57% was in 2023, and 2024 it was 50-55. So slight improvements, but we got a long way to go. 62% of dog owners and 53% of cat owners said, I have tried to help my cat or dog lose weight. So again, over half of cat owners are saying, yep, it's a problem. My vet raised the awareness. I raised the issue. For whatever reason, I tried to do it, but guess what? They didn't have much success. And when we say, how did you do it? Only a quarter of the cat owners said they'd actually tried a therapeutic weight loss diet. Now, this is really important because too often people think, oh, I'll just feed my cat less food. The problem with that approach is that you're now feeding them less protein to preserve muscle mass. You're feeding them less vitamins and minerals for immune health, right? I mean, you're robbing them of the nutrients at the expense of calories. And so the reason that you hear vets like me continue to advocate for therapeutic weight loss diets is because they maintain high levels, in many instances, elevated levels of those essential fatty acids, right? Or of vitamins and minerals. They're going to boost the protein and fiber for satiety, all without any risk to long-term health while helping lose weight and reducing calories. So, again, we just don't have great tools yet. I mean, maybe some tools are coming in the future, but therapeutic, specially formulated weight loss diets are really our secret. Now, again, if your dog or cat needs to lose a couple of pounds, you may be able just to say, reduce the treats, reduce a little bit of the feeding, and you'll be fine. But once they cross over into obesity, we can't reduce the calories enough without risking reducing macronutrients, like again, fats and proteins and carbohydrates, and micronutrients like essential vitamins and minerals. So we got to be super careful with how we do it. Well, what causes this, Dr. Ward? That's the question I get. So why? Why do we keep seeing this? Why is it getting worse? Why is this a big problem? Well, the reality is it's multifactorial. And I can show you, and I will show you several bits and insights into some of the literature, but we know that genetics and epigenetics play a huge role in the development of obesity in cats. We know that their life stage, so overfeeding during the kitten stage, is actually really compounded over the lifetime of that cat, right? We also know that if we don't make adjustments post spay and neutering, again, that can cause tremendous issues with body fat. The diet, overfeeding, we got that, but there are hormonal and biological processes that are altered for sure. We know that sometimes these cats are put in confined spaces where they don't have adequate activity areas. They can't go vertically. They can't do anything to actually exercise, and that's going to be a problem. They may have another another disease that causes them to gain weight. They may be on certain medications that cause them to gain body fat. And again, we're seeing more and more research and literature around the effects of the microbiome or the gut bacteria and its influence on obesity, as well as all of these endocrine disruptors. Again, the microplastics that we see and hear about in the news, they are real issues that, again, we're starting to really confront. If we look at genetics, and again, this goes back, we've known that genetics were a leading cause going back to at least 2011. And when Herring first published this, a lot of folks were skeptical. I had actually published my first book on obesity in 2008, and I had an entire, half of a chapter on genetics. But at that point, I couldn't say conclusively, and I couldn't point to a lot of really benchmark foundational science to support that claim, but we all knew it was true. But again, finally, we had the first study in which a genetic component could be shown to be responsible for the development of overweight in cat. And again, Herring's translation there, overweight, which was gaining weight, extra body fat. So again, this goes back a while. Now, this is a simple chart that I like to share with my veterinary colleagues, and that is that when I look at all of the evidence, and I've been very involved with genetics, helped start a company and work with a company with feline genetics for many years. But when I look at the literature, there are really 3 or 4 genetic mutations or markers that we have strong evidence for. Now, the 2 leading, the ones that we know, I mean, we have reams of evidence, and actually these are also in humans, but the POMC gene is one of the first one in the MC4R. And the POMC in simplest terms is, we call it the food drive gene. So in dogs, I call it the trainability trait because dogs with multiple copies of the POMC mutation are highly food motivated, easy to train, and they're called Goldens and Labrador retrievers, right? I mean, obviously any dog can have the POMC mutation, but we do know that it makes them highly motivated to seek out food. Well, guess who else has the POMC gene and mutation? Cats and humans. And so, a lot of times I think when people have been evaluating the GLPs the last decade or so in humans, they're realizing, wait a second, the food noise and the lack of satiety, it's probably also the reason we're tuning that down with the GLP-1. So it's fascinating. Again, the MC4R, it's a very complicated pathway, but the reality is that it does also have to do with satiety, feeling full, turning down food noise, if I can sort of co-opt that term, which I'm not a huge fan of. But all of those things, again, are also involved with cats. Now, cats also have the FTO gene, which is a strong candidate. FTO has been clearly associated with obesity in humans, so we're watching that. And then there's 2 other pathways, the leptin and adiponectin, those pathways with the LEPR gene. We are seeing now, I showed a picture of a British short hair, but we think that's probably involved there. But again, these are emerging. These are good signals, and I think we're going to see more as we move it. The relationship with the human, though, also is a driver for overfeeding, and cats are very good at manipulating us for sure. Begging, pestering, these types of behaviors really do cause people to do things like the all-day buffet where they just feed them all the time ad libitum, and that's not a problem. I mean, that's a problem for many cats. Again, I think that when veterinary professionals say, oh, I'll just tell the owner to feed X amount, X times per day, they will adhere to that. Well, it's just not that simple because, again, when you've got a cat pouncing on you at 2 a.m., demanding to be fed, very few of us are willing to say, nope, I'm going to just suck it up and stick it out. We go and feed the food bowl, fill the food bowl or whatever. And so we know from studies that actually what I just described is actually true. This goes back to Day's study or observational study in 2009, really, kind of right after I had my first book, I was kind of making a lot of speculations, and I think a lot of folks said, hey, let's go and verify what Ernie was saying. Again, we also know that what happens that when we spay and neuter our pets, and I'm proud to serve with WSAVA, the World Small Animal Veterinary Medical Association. It was just at the annual conference and General Assembly, and I'm on several committees there that deal with this, and we have a new revision to our spay neuter guidelines. But again, one of the things that I was clear and very passionate about was make sure we included the role in metabolism post spay and neuter. And again, even if we go back to Cursier's first paper on this, which is back 13 years ago now, this is a clear association. When you spay or neuter your cat, especially the earlier age, spay and neuter, then that is going to change not only their energy requirements for the rest of their life, right? Because reproductive hormones are now absent, but also these pathways for fat deposition in cats and dogs to a slightly lesser extent are going to be altered. So that means that these cats are actually better at storing extra fat. Now, that's a mouthful and a lot of complicated sort of proof, but the reality is these cats are going to be for the rest of their life, at greater risk for developing an unhealthy body condition. Again, when we kind of look at that pathophysiology, and I'm proud, I'm the editor of the upcoming clinical obesity textbook on Wiley next year, and I've got tremendous amounts of sections on the physiological changes, the metabolic pathways that are disrupted during obesity, either direct causality or as a consequence of. So it's, again, when we look at sort of the underlying biology of obesity, you start to realize there's a lot more than just feeding too much and exercising too little. I mean, this is multifactorial at its finest. Okay. Again, more and more research emerging over the last decade on all of these microplastics, these endocrine disruptors. Remember, it's not, a lot of times we think in terms of dose dependent. We think that, well, for something to be poisonous, we have to drink or eat or somehow expose ourselves to large quantities of it. That is not how endocrine disruptors work. In fact, for many of these compounds, it's the trace amounts, the parts per billion that actually impact the physiology, not the parts per millions or parts per thousands, like the large quantities. It's actually the tiny quantities. And so this is why you're seeing this surge in research and awareness around the dangers of microplastics. And again, I don't have a solution for it, but we know it's part of the problem. And we know certainly things like bisphenol A are directly related now to development of obesity in the form of excess fat. In my upcoming textbook, as I mentioned, I have an entire chapter written by a couple of the world's leading experts on this, because this is such an important issue that, again, I wanted to make sure veterinarians and veterinary students are taught the pathophysiology of these endocrine disruptors. All right. So again, the short list, you guys probably are familiar with these terms, the BPAs, the phthalates, and the atrazine, of course, which has been banned in Europe for a long time, but still, used in countries like the U.S. Again, the relationship, we talked about sort of, it's much more complicated than just saying feed this much, this many times a day. We know that finicky eating, begging, again, there's a whole sequence that happens. And again, this is no news to my cat loving fans out there, because we know that, there's a whole ritual around the food bowl, right? Pre, during, and post feeding, and all of those little actions, manipulations, I would call them, by our feline friends, are actually encouraging us to feed more frequently, to give additional treats and so forth. So again, cats are really good at reading our own emotions, our own actions, and then bending our will, right? So, I mean, I love cats, but they are really good. Now, if you're a veterinary professional, and again, we want everybody to take the survey, including veterinary professionals, but we do ask pet owners every year, where do you get the best advice on food, right? So we know it's a complex issue, right? There's lots of choices and lots of confusion, lots of marketing and lots of hype, right? And still people, say a veterinarian is my best, most trusted source. The problem is they don't often have access to veterinary professionals. So now they're just kind of online and they're searching and they find something that seems to sell them what they want. So I would always say to my veterinary colleagues that are watching this, whenever you're watching this, remember that they value our opinions and perspectives. They want our advice when it comes to dietary selection. And so I think sometimes vets go, oh, they don't want to hear it. They don't want to talk to us about this stuff. They do. It's just we don't often give them that opportunity. And that's a whole nother issue for another day. And it's one of the reasons I do a lot of continuing education for vets. So if you're a pet owner today, I'm constantly lecturing to vets about how to have these conversations. So why does this matter, right? So really, you made a case out there. I want to go back to those consequences, especially for cats, because they are unique. And so when we look at, and this was a very big study back to 2018, and this was one that they looked at medical records, and this was one of the larger corporate entities in the United States. And they found, okay, let's take and look at overweight and cats with obesity. Let's look at the medical records and see, do they have more of certain diagnoses? conditions, diseases, infections, and so forth. And they found, yep, no surprise, kind of matches up with that earlier list I showed you. If you look at all that individual, guess what? Lower urinary tract disease, so UTIs, diabetes, again, no surprise there. Breathing problems, skin infections, which is again that sort of overlooked. I find so many of my veterinary colleagues forget with dogs and cats with obesity that skin problems follow. And this is not because of folds in the skin. This is because of systemic inflammation. One of my authors, again, when you kind of immerse yourself in this for 20 years, I have an author who's written an entire chapter on dermatological consequences of this, right? I mean, this is a very big deal with obesity. And of course, trauma. And these traumas were typically injuries to limbs, extremities. And so I would say that is a little bit of a weaker part here. I don't know if these cats were falling, if they were being injured. We don't really know. Were they unable to escape from danger? That was an unclear one in this survey, but again, they were just looking at medical records and doing that. Again, they kind of looked at other terms that were popped up in there. Dry food did pop up. I think, people always say, well, why do we see more cats with obesity that are fed a dry diet? And it's very simple, guys. It's portion control. You're imprecisely feeding. You don't really control or know exactly how many calories you're feeding per day because it's not contained. And back in 2006, in fact, you can dig it up on the website, we did a little pilot study in cats. We took the top 10 dry foods at the time, and these are you know these brands. You walk into a grocery store or pet food store and you see these brands. They're popular today. And we said, how much would you have to overfeed of these 10 most popular dry dog or cat foods to gain an extra pound a year, right? So that seemed like a pretty reasonable. So you got a 10, 12-pound cat. How much you have to overfeed every day to equal a pound of weight gain, or 3,500 kcals over a year? And guys, it's shocking, but it's about 10 individual kibbles per day. So that means if you're imprecisely measuring by 10 kibbles a day, at the end of that year, you've gained a pound. You've put an extra pound on your cat. So you can see when people say, is there something about the dry food? It's not. It's really not the formulation, the processing. I mean, we can make arguments for all those things, but at the end of the day, weight gain, fat gain is due to excess calorie intake, and it's stored now. Extra energy is stored as fat. And so for me, that's a very simple calculus, right? It's just the imprecision of the portion control. Again, just getting back to these lists, and these are from multiple studies. But when we look at all these diseases, these are in cats, right? And so these are those things that we start to see. Now, obviously, when we look at all across species, you start to see things popping up, gallstones, psoriasis, all that. I mean, there are multiple studies that show all of these types of conditions across mammals or mammalian species. It's all a direct consequence. So we can do better. All right. One of the things too, I just want to briefly touch out, because this is again, I'm working with all these people. This is a team out of Japan, and I'm so lucky to get one of these top researchers to write an article, a chapter in this upcoming textbook for vets and vet students on this exact issue, because inflammation and inflammatory biomarkers in cats, we've kind of had a lull, right, over the past 20 years. We made tremendous advancements in humans, and so many of you now are familiar with C-reactive protein, which is a very useful inflammatory biomarker. But sadly, it doesn't really work that well. It's not a precise inflammatory biomarker in cats. Now, in dogs, it's validated. I have a lot of clinical utility for it. In fact, in my canine patients with obesity, that's going to be one of the markers that we look at, and we actually see the trend line going down as we resolve excess body fat. But for cats, it doesn't quite work out that way. And so this is a brand new study that just came out a couple of months ago. And again, a team from Tokyo just doing some amazing research. But one of my favorite biomarkers for cats to measure systemic inflammation is something called serum amyloid A, or SAA. Now, there are a couple of labs, big labs in the US that are monitoring this for our veterinarians. One of the labs says it's poorly validated. The other one says we have our own internal validation. So, we still are working it out. Obviously, in Tokyo and Japan, they feel like they have a very solid validated. But what this study looked at was, okay, they're trying to help us all in this pursuit of clinical obesity. And so they found that, again, cats that had high blood fats, hyperlipidemia here, high ALT, which again is that liver biomarker. And we talked about that there's so much more to have liver disease in cats with obesity. It's not just hepatic lipidosis, but there's this really high, much more metabolically associated liver disease that we're calling it now, and SAA. So basically, this team is proposing that we use those as the cutoffs. I don't disagree. We're working on a very complicated document for these biomarkers at the Association for Pet Obesity Prevention. And this is, of course, matching up with what our recommendations, our consensus panel will most likely publish as well. So again, remember, there's a lot going on with obesity that you don't see, and inflammation is one of the things, which is why I always say that obesity is a chronic inflammatory disease. That's what we want to take away. Remember the very first slide, I see inflammation. Now, what can you do if you're out there watching this, if you're a veterinarian, if you're a cat lover, whatever? The first thing is you got to recognize that the cat has excess weight, right? And we're going to use weight as sort of the foundation. It doesn't indicate excess adiposity or body fat. It doesn't indicate an unhealthy body condition, but it is that easy first entry, and it's sort of like BMI, in my opinion. It's sort of like gets you in the ballpark. So if I see a 16-pound cat, domestic short hair cat, I'm automatically going to be now on guard saying, this sounds like excess adiposity. It sounds like an unhealthy body condition. It sounds like overweight or obesity, right? So now I'm going to go to my next step, which will be that body condition score for sure. Now, I'm also going to ask about the medical history with, any concurrent, conditions. What about diet and feeding? But I also know that sometimes that type of medical history is less conclusive and less accurate. And so, it's something I'm going to ask and focus on, but I'm going to say, first of all, well, we were 12 pounds last year. We're 14 pounds this year. Honestly, what you're feeding, the specifics of it is immaterial to the discussion because something's wrong, right? So that we're going to investigate. Of course, now I'm going to do really my most important part, the reason you need to take your cat in at least yearly, if not more frequently when they get older. And so that's when I'm going to do the body condition scoring, and I'm also going to do a muscle condition scoring. And that's really important because we don't want cats to lose weight and lose muscle. Right, because then they're not going to be able to ambulate, jump, enjoy life. They're not going to be. They're going to be frail and fragile. And so the goal of healthy weight loss is to lose the excess fat, not the muscle. In fact, you really want to preserve, if not enhance, lean muscle mass. And there's some tricks to this. And of course, we're really getting a great sort of education from the human side because they're putting millions of folks around the world on GLP-1 RAs, these GLP drugs like Ozempic and Wegovy and Mounjaro and so forth. And so we've figured out, oh, wow, you can't just put them on these weight loss drugs because they lose muscle mass. So we're really, refining that. And I think a lot of pet owners are starting to understand it. And the most important thing a vet can do is give you specific recommendations. The worst thing that can happen is for that vet to say, well, we got to change our diet. Well, we got to feed less. Well, we got to do exercise more. We need specifics. How many calories? Now, I'll show you on the website in just a couple of seconds. We got some tools to help facilitate this, but we do need specifics from the vet. So if you're a veterinarian watching this at some later date, really make sure you give specific recommendations because there's nothing more empty and vacant than just saying, well, we got to change things up. I need real details before I'm going to do it. Now, you guys know these formulas. And again, these are the two formulas, the Kleiber or allometric formula in which we use the exponential, because the way mammals use energy. So that's going back to the Kleiber original from the 60s. There's a simplified version. This is kind of the one that I carry around in my head because I'm a simple guy. I don't do really good with exponents, but these work great. Now, in general, cats adhere to the simplified version, the linear version, much easier than dogs. Dogs, because of their wide range and body size, remember that the smallest breed to the largest, there's a 40 times difference in body mass between like the tiny little teacup Chihuahua and the Great Dane, Borzoi, whatever. I mean, these giant breeds. So 40 times, whereas cats, we don't see that big of a spread. You got the Maine Coon versus a regular, and that's like a two to 2.5 times spread, so 40 times. So this one works really well. This one I use more for dogs. And again, for most cats that need to lose weight, we're going to reduce their resting energy requirements unless they're an outdoor cat or have other issues. Protein, though, is the key macronutrient to focus on for cats. So when I'm talking again about those therapeutic diets, the ones that are actually designed to help your cat lose weight while maintaining muscle mass, we're going to focus on proteins, right? Highly digestible, highly bioavailable forms of amino acids that are gonna, again, help provide satiety, because protein is one of the key signals that tells your brain I'm full, and also to enhance and prevent muscle loss. So that's really, really important. And you don't have to do those calculations if you're a vet or a pet owner. We have a whole variety of calculators and estimators on the website. So if you go to petobesityprevention.org, you're going to see like pet owner calculators, vet calculators, all this kind of stuff. And so here's just some of them. We also have others that aren't actually on the screen, but dog feeding, cat feeding, dog weight range, cat weight range. You can actually, we'll tell you some estimate based on body weight. And again, dogs, we require breeds. We do have all the popular breeds, or the most popular breeds in the US and UK. And then, of course, we have for vets, the DER, or the daily energy needs, the MER, metabolic energy needs, as well as a step weight loss calculator. So you can just kind of, if you want to go over here and just kind of punch in a few variables, it'll tell you approximately how much you should be feeding your cat. But again, you have to use your veterinarian's directive. For weight loss, for veterinary professionals, we have automated, if you go back 25 years, I've been advocating a step weight loss plan, and I'll give you a couple of little scientific reasons why in a second. But basically, this is an example of a step weight loss for a kitty cat that needs to lose, 5 or 6 pounds. We do those in 3-month increments because, again, if you have a cat and you put it on a therapeutic weight loss diet, and let's say 3 months later, it didn't lose about 1 pound to 1.5 pounds. In simplest math, most cats on a safe, gradual step weight loss plan can only lose about 0.5 pound per month maximum. Now, obviously, a very, very large cat, you're going to see a little more improvement. Smaller cats, you're going to see less, but about 0.5 pound a month, right? Anything beyond that typically is not sustainable and does risk losing excess muscle. So there's a thread that we're trying to make sure we walk very closely. But again, this is a great way to start. At 30 days, 3 months, 90 days, if you're not seeing improvements, change something. Okay. You need to change diet formulation. You can't reduce calories below 70% RER, again, without risking taking away too many of the essential nutrients, the macronutrients and vitamins and minerals that cat needs to be healthy. But we're going to change something at 90 days, right? And often this will be, for me and my patients, changing brands, right? So we'll change something else, but do not make the mistake that I see so often where the cat comes in and they've been on diet X, which is a good weight loss diet for cats, for a year, and the cat's gained 1 pound. That just tells me that the physiology did not match the formulation. So we can do better, and we must do better. But at 90 days, if something is not working, if we're not getting the expected results, if we're not seeing that gradual decline in weight, especially around 0.5 pound a month, then change something. Change. That is our friend for sure. Why do I say this? Well, there's really 2 main reasons. The first is what we call metabolic adaptation. If we take a mammal and we just suddenly go from calorie here and we reduce it 50%, just right? So, well, we need to this is your ideal weight, you're way overfeeding. We kind of dramatically decrease the number of calories, forget the nutrients, forget all the other issues we might be creating. But what it does is it triggers the body to go into a self-preservation mode, a metabolic adaptation that says, we're going to readjust our physiology so that we can work within this lower calories that you're suddenly now feeding me in starvation mode. And now you actually start to see plateauing. And this is why, for years, people are like, man, I'm on a crash diet and, I lost some weight and now I'm still eating no calories. I'm hungry all the time and I'm not losing any weight. Well, the physiology, the metabolism was adapting. And so there's tons and tons of research to support that for sure. Again, we're just kind of keep going on with dogs and cats. All of these things just prove metabolic adaptation, which again gets us back to the step weight loss. I do want to focus on one other thing though, and that is these begging behaviors. Because when we do crash those diets, we suddenly say, well, I'm going to feed him half of what I was feeding. I'm going to feed him a quarter of what I was feeding him. Again, not only do you trigger some metabolic, physiological, biological changes, but the brain is like, whoa, no, 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 no. I mean, so these cats get very anxious, they get very stressed out, which creates an entirely another set of problems, especially related to cortisol. And so now we're going, oh my goodness, we've created a situation where the body's adapting and the behavior is starting to really become problematic. So we've got to do a better job just in general for sure. Okay. So we can do that. Now, if you're a veterinarian, if you're a pet owner, if you work with a cat organization, I really want you to go and let's look at how we communicate this. And so, after a year's work, we published early at the beginning of this year our guidelines for pet obesity communication. And this is really important. If you work in a shelter, if you have every cat, we want to make sure that we're using language that is respectful and informative to describe obesity. And so, again, terms like even calling obese and things like that, we can do better. We can be less judgmental. We can be much more, again, respectful. We can use a pet or patient first language framework to help with this for sure. We also want to make sure that we continue to focus on fat loss and a healthy body condition. That's why you keep hearing me say these things, right, over and over again, because the real issue here is one of inflammation driven by excess fat. I mean, it's pretty simple. This isn't about looking good or whatever. This is really a physiological condition. We want to make sure that we communicate that the goal is to preserve lean muscle mass, to preserve strength and the ability to move around and ambulate, right? And again, non-judgmental. If we blame cat owners, dog owners, horse owners, rabbit owners for their pets' obesity, then again, I would say we're probably going to fail, right? Because we need to give them real suggestions in a fashion that is compassionate, empathetic, and most importantly, effective. So I would really encourage you, especially if you work with any organization or group that communicates and obesity is part of that messaging, or you encounter it, you should take a look. I know it's a big thing, but find the section that applies to you, look at the examples and see if it doesn't make sense, because I think you'll see, and we've kind of lined up with human obesity experts with this. And that's, we worked with some amazing folks from all over the country on that report for sure. Now, what can you do if you've got what are some more practical bits? The first thing, especially for multi-cat households, is you've got to teach your cats to feed at certain times for certain durations in certain locations. This means separate feeding. Now, I've only ever done this with mine. And so, I mean, from day one, they were brought up this way, so they don't know any better. But if you are now confronting this, I mean, again, you want to get small little, soy sauce bowls, small bowls, right? I don't care if you're using canned or wet or fresh or whatever, but the reality is separating that food, because that does two things. Number one, it allows you to accurately assess who's eating how much when. The second thing it does is it helps eliminate what I call the food bowl bully problem, right? Which is typically witnessed by multi-cat households where there's one cat who kind of dominates the big all-day buffet bowl, and the other cats are really intimidated and don't eat as much as often, right? And so you wind up actually incentivizing the food bowl bully, and they develop more obesity, and the other cats are kind of skinny and healthy, so to speak, but they're not eating adequately. They're not eating, and they're stressed out. So there's a lot of issues. So separate individual feeding. The other thing too is if you're new to this, what you typically wind up doing is putting down the food for a set amount of time. And I mean, just tell your smartwatch, say 15 minutes. And at the end of 15 minutes, pull it up. You're not going to be cruel. Cats and dogs are really intelligent folks, and they learn very quickly that, oh, there's now a period in which I need to eat. And again, I think for our cats, it's about 30 minutes. That's really when we're getting ready in the morning. And if there's anything left over, which there isn't, but if there is, then we would just pull those bowls up. And so I would really encourage you to start to say, how can I incorporate something that allows me to assess who's eating how much, take away some stress that might be around a communal bowl, and at the same time, teach them more healthy habits, right? So again, figure out what you want. Time meals, we talked about that. love hunter feeders, love food puzzles, all those kind of things are super, because now we're tapping into that inner predator. As I always say, engage your cat's inner predator. So anything you can do to help them mimic sort of stalking prey, I think that's super helpful for them. I do like automated feeders, and they're getting more and more sophisticated. We've got some with several, you can put collars on your cat so it identifies when the cat approaches the feeder. It also can tell you when and how much you fed. And again, there's so many of these solutions. I don't endorse or recommend any particular brand, but I say look at them. There's a wide variety of cost associated with some of these, but I do like them. One other caveat: if you're looking at getting one of these, I would start by getting one. Kind of my baseline entry is, do they allow me to feed 4 to 6 times per day? Anything less than that, probably not going to be super helpful, because remember, I'm often doing this to help mitigate some of those midnight feeding runs, right? That 2 a.m. pounce. So I really do want to be able to set it on a timer or have some kind of access to maybe help that cat that wants to do that, right? Again, find the food. One of the simplest things you can do is just moving the food bowl, especially if you only have a couple of cats. But you can even moving it within the same room to a different location, just give some intellectual or mental stimulation for sure. And again, high and low feedings. I like things that activate that vertical movement. Cats like to be high and low. And so maybe even just altering, putting up on a stool or a counter or whatever you are comfortable with or can do. But again, just giving variety. I think that's something that we forget about a lot with kitty cats for sure. And then really the last thing I want to talk about before we take a couple of questions is the canned versus dry debate. This comes up all the time with cat owners. And as I mentioned in the beginning, why do cats that seem to be fed a predominantly dry diet have more obesity? And I said it's about portion control. And that's why canned diet typically is more recommended by folks like me in the obesity sphere, because we are containing the calories. So see, even if you have to feed 3/4 of a can, let's just say, well, over the course of 3 days, you've still fed that whatever amount you were setting out to feed, you're feeding that amount. Whereas with dry food, again, and you're inherently adding on these 4 or 5 kibbles extra here, 10, 20 kilos extra here. And we know that adds up to significant weight gain. So, I do like some of the fresh food companies, especially on the dog side, that actually go ahead and do some very, very sophisticated caloric calculations and say, these are the number of calories your dog should get for 2 days. And again, just no mistakes, right? So if you're struggling with feeding extra, you really do want to look at some of these sort of canned solution, because again, I call them containing the calories contributes to healthy body condition, right? Containing the calories. That's really the way it starts off for sure. All right. So again, I'm going to leave you with this. Please take a screenshot, take a picture on your phone. Go and take the survey. It literally takes you a couple of minutes. Share these tools and resources. Share that QR code on your Facebook, on your Instagram, on your TikTok. I need as many cat owners. As I mentioned at the beginning, we get a ton of dog owners, and I still want more. So if you have dogs, and actually in the survey, it's going to say, do you have cats? Do you have dogs? Right? So if you have both, you can participate. It makes it easy. If you have cats, well, half your work's cut out. If you only have dogs, you don't have to do cats. But we really do need your help, because I need more insights to share with the veterinary industry, because we are desperately trying to solve this problem and we need your help. So again, that is it for me. I think we have one slide here. This is for the Every Cat Foundation. And if you could scan that, you can donate. Your dollars go directly to research efforts. They do some amazing work. And so this is, again, those areas that we forget about as cat lovers. We kind of go, oh, they're all taken care of. Big universities, big pharma companies are taking care of it. They're not, guys. We need your help. Every little simple contribution makes a big difference. And I know that there's a lot of demands on us to be, with our charity, but this is one of those things where if you can give, a little goes a long way. So that is it for me. I
Hey,
guess we can take
I
some questions.
yes, I thank you. That is awesome. So we do have some questions, but I also have some of my own too.
Good.
First one, and this was kind of interesting. I know this is a problem. I heard this a lot when I was in practice. My cat is so picky. I tried giving her other food besides her simple dry kibble, and she just won't eat it. Any tips if I try a therapeutic food or diet that she just won't, and she won't eat it? I know that I was always taught cats are neophobic. Anything new, you know,
Yeah, it depends on the cat. I would say, I was taught the same way, Virginia. And for me, really, neophilia starts when they're kittens. So you do want to introduce them to a variety of flavors and textures and form factors. And so if you are getting a new kitten or you have a friend who is getting a new kitten, make sure that during those first few months that they introduce them to a wide variety of flavors and scents and different textures, because that will set them on a lifetime of being more accepting. I think what happens, just as you described, is literally they were only given the one kibble from kittenhood, and that's like, oh my gosh, anything else could be dangerous. And I get it from cat. Now, getting back to the original intent of the question is, I got a finicky cat. I'm scared. Well, the first thing we're going to do is really look at the needs of that cat. As I mentioned before, it's going to depend on where it is on that scale of obesity, right? So I may be able to work with it. You may be overfeeding significantly, and therefore, just by reducing, I'm still not now somehow reducing essential nutrients, right? So we don't know where the headroom is in that diet. So I may have plenty of headroom to start. What I do find though is that most cats, it's not like they're feeding them twice too much, Virginia. They're feeding them like 10 to 20% too much. And now I don't have a lot of headroom to really further reduce. And you might have noticed that I quickly said 80% of RER is where I start with cats. Well, what I'm already saying is that we've calculated the resting energy requirements. So these are basically what your cat needs if it's largely inactive. And now I'm making two assumptions with that calculation. One, it's spayed or neutered. Two, it's an indoor cat, which probably describes most of the folks watching this today. Okay. So now if they're indoor, spayed and neutered, we can say, okay, the resting energy requirements are already going to be reduced. So that's where that 80% originates, because quite frankly, I'm already just playing the spay neuter game. Now, I don't have any way to reduce calories without reducing fats, and fats are essential for the immune system, for the hormonal system, for the brain and eyesight, right? The nervous system. So this is where we get into those therapeutic diets, because now they're going to re-add extra DHA and EPA, for example, those essential fatty acids, and they're going to reduce carbs and other fats to knock the calories down. So it gets to be a little bit of a numbers game. And again, as someone who had a pet food company for years, these are the games I've played with formulations, right? So we're just trying to say, how do we boost this and reduce that while still maintaining health? So talk to your vet, calculate those calories, see what kind of headroom you've got with the existing diet. And then here's what I say to those finicky cats. I try to find an adjacent solution. So I try to find something that is close to what you're feeding now in terms of flavor profile and texture. And then I say, okay, it's not exactly, but it's 70% same. And I'll tell you, Virginia, I couldn't do this 25 years ago. Today, I can probably find two or three close approximations, adjacencies that we can say, let's try it. And then just don't buy a big bag. The great news is for most of the therapeutic diets, your vet, you can probably return it if your cat just outright rejects it. But one bit of caution, Virginia, just before we go, if your cat refuses to eat for 48 hours, stop. Get them to eat whatever it is because once you start cracking 72, 96 hours, we're now going to draw on the liver stores of glucagon, this form of sugar. We're also going to be maybe sort of liberating some fat, and that's where problems begin.
Um, this is something that I've heard, if you want to entice a cat to at least get interested in a new diet, water from water pack tuna.
Yeah, I mean, all those kind of solutions can definitely work, and I like that sort
Starts
of
it.
approach. We're using a broth, a tuna juice type thing to enhance flavor without adding a lot of calories. So anything like that works. Sometimes just warm water, like just actually warming the food, can also enhance again aroma, which leads to enhanced palatability. So what I just again I think too often, Virginia, we just throw up our arms and go, oh, well, I tried it and she didn't like it, and we really didn't try it. We didn't get creative, and so get creative.
All right. One of the questions she has, this is two overweight spayed cats, Norwegian forest cats. She's a breeder. She has several cats that their body condition score changed right after, like within a couple of months of spaying. Her cats are on microchip feeders. So what is,
Yep.
what is she she says she follows her diets and they are on the microchip feeder. So what would you recommend for those particular cats that because of their circumstance change, spay, um, their nutrient requirements are different?
I love all of this, but there are several obvious red flags. First and foremost, this is a breed that is predisposed to obesity. In fact, I can tell you there's some very interesting research using them. And we talked about some of those LEP, LPR, genetic mutations, even FTO and POMC have been looked at with Norwegians. So, first and foremost, there's a very good chance that the cat that is having the issue has multiple copies of a genetic mutation. So let's just kind of set the table right there. And I see this all the time, right? So again, we just want to make it like a community-wide problem, and it's an individual problem. Okay, so we can't just always say, oh, there's the problem, it's because Americans do this or that. It's like, it's individual. So that's going to be at play. The second thing is spay and neutering, as you've correctly identified, that's going to reduce everything. And then you go, wait a second, I've got the calories dialed in, I've got the automatic feeder, so I'm precise in the amount of portions, right? This is where formulation kicks in. Back in the day, Virginia, you recall this, we had one weight loss formulation for many years. So this goes back 30 years ago. And the formulation was based on a simple precept, but that was that fiber makes you fuller. Okay, so this is a high fiber approach, and you would feed these dogs and cats high fiber in an effort to do two things: to actually absorb water and swell the stomach and the upper GI, so that you felt fuller faster. That was just the basic concept. Well, guess what? It's not that simple. Not everybody has those exact receptors that respond to that stretch mechanism. And this is one of the reasons why you heard all about leptin 20 years ago, and now you're hearing almost nothing about leptin, because that was one of the primary pathways or signals that was tapping into the fuller, faster. So I'm getting to this roundabout way of saying these formulations are unique to the individual. So I can have two cats literally from the same litter, okay? And they are going, one cat maintains a healthy weight, the other doesn't. So first of all, genetic mutations may be at play. Second is that physiology may say, guess what? I only do well with high protein, high fat. That is actually where I thrive. And this other cat's over here going, oh, you know what I do? Low protein, high fiber. And so this is why I always tell people at 90 days, change your approach, change your formulation. I mean, we will reduce calories, but I'm telling you, most of the time I am changing brands of food. Now, not every cat, as you mentioned, the other question, not every cat is willing to be so adaptive, but most do, because I can usually find something that's kind of close and they like the flavor aroma. So the first thing I'm going to say is for the other cat, let's see if we can't change the formulation. Now, if you have to feed them both from the same feeder, it's not going to wreck the other cat's physiology to maybe change another approach, but change something, right? Because again, I see this so often. We get locked in, Virginia, we get so fearful, and then we just expect a miracle, and it just isn't going to happen. So change something. And for you, I'm going to say change the formulation. So if you're on a high protein, let's switch it up and go to a high fiber, right? I'm going to change big changes.
And this is definitely something though she wants to talk to her veterinary care team about, right? Before she
Absolutely. Yeah. And really kind of get steered in, because there's a good chance that the formulation is going to need a slightly more an advanced analysis, because I'm really going to look again at, whoa, where are they, how are they adjusting? Because I will say this, what I've learned in 25 years of working exhaustively in obesity is when I make those first two changes, because this happens all the time, where I get the kitty cat, they lost a little bit of weight the first couple of months, and now we've plateaued, right? I have learned a long time ago, don't make gradual, subtle shifts, swing for the fences. So again, if I'm on a high protein, I go to a high fiber. I go to the other end of the spectrum, because what I'm trying to do is gauge that cat's physiology, because it's different. And so then, if the big swing didn't make it, then I come back to the middle. But I will say this, rarely do I encounter a patient that after really it's about by the third shift, again, big shifts in macros, that we found something that's working.
Yeah. Okay. And she does say that she's noticed that the spayed cats do have reduced energy. And so some of the things that you mentioned about, hiding the food and doing some other, activity, food puzzles and things like that, I think that kind of helps keep them active as well. All right. I know we're down to our hour here. One quick thing I wanted to ask about real quick, and this is just from me. we had this conversation a little earlier before about human dietitians. Um, why, I mean, why, let's, would you ever recommend to somebody who's in like a situation like this particular attendee is to contact a veterinary nutritionist?
Oh, absolutely. All the time. And that's a lot of our referrals, especially when we start getting in these situations where the dog or cat needs to go below 70% RER. And so, it's not that it can't be done, it just needs to be done very carefully and precisely. And so there are tons of dogs and cats I've worked with that we're down at 60% RER, really restrictive, but
Yeah.
we're boosting all those essential nutrients, vitamins, minerals, and so forth. And that's really the game that we play because, what you find is that the body is incredibly resilient and adaptive. And so it can do a lot with a little, but if you don't give it the little bit that it really needs, then things fall apart quickly. And that's where just feeding less never works. Weight loss, healthy weight loss is not about starvation or deprivation. And I think that's kind of where I start. I go, I'm not starving my patients, and I'm not going to deprive them of the joy of eating or even giving treats. But now I'm going to just have to say, how do I work those two things where I give a satisfying, pleasurable feeding experience, but also accommodating the nutritional needs? And it can be done. It's just it really requires two things: a veterinary team who is knowledgeable and willing to have these conversations, and then a pet parent who is willing to actually adhere to them. And I find that, roughly 70, 80% of the time, those things align and we're off to the races and great things happen. And then, really, for the other 20, 30% of the time where either the vet team falls away or the pet parent falls away, that's just kind of life. And I can't control those. But I will say this: the majority of cases have unbelievable outcomes. They do well. And, usually for cats, this is about a year journey for most of the patients I have to deal with, because again, they have, more significant obesity issues. And at the end of that year, most of the time, even if they haven't reached that, target ideal healthy body composition, they are going, I can't believe it. My cat's a new cat. We're seeing less litter box accidents. I mean, I'm seeing much more activity. They got the zoomies back, all those kind of things that just bring joy to me as a vet.
So then, just the other thing, I just want to just pop in there and say, talk just briefly about GLPs for cats.
Yeah, yeah, great question. And on the website, you're going to see, I wrote an article about this a year or so ago. I will say that GLP-1s are being actively investigated. There's some FDA clinical trials ongoing right now in cats. And
Love
so
research.
it's exciting times. The big question people say is, when's this going to happen, Ernie? I will say this, based on the current, I mean, nobody knows the current, right now we're in a government shutdown. We're actually recording this, but I would say the earliest would be 2028. But I think you're going to start to see that happening 28, 29. So it's not that far off.
So that's good. I mean, that is another tool in the toolbox,
It is. And what's even more interesting, because people are like, oh, there's no way we'll be able to afford them. All of the drugs that I'm aware of that are currently undergoing trials are off patent. So these are tirzepatide, exenatide, right? So remember, these GLP-1s have been around for over 20 years. I mean, people kind of forget that because it's a big new thing. But these drugs have been exhaustively used. Again, they were primarily used to mitigate high blood sugar, right? So as a diabetic assistant, and so when you look at some of exenatide and tirzepatide, which again have been around for 25, 30 years, they aren't as effective as some of the newers and even the newer GLP-1s. And we're actually about to see the beginning of the next generation, which will be even more effective. But for cats, remember what I said, that interesting, it's about a half a pound a month. These are
Yeah.
perfect for that, right? We don't need rapid weight loss. In fact, I think you're going to quickly start to see the discussion in human medicine switch from losing weight to we're losing it too quickly, because
Yeah.
now we're sacrificing muscle mass. So I'm actually super excited that these older, sort of forgotten GLP-1s are actually going to be probably the first things we see in vet med. And also cost, right? Since these are generic forms, they're going to be much, much, much more affordable.
I'm excited about that. Any other tool that we can use, it just because obesity to me, as a veterinary technician, especially seeing the overweight cats and the overweight dogs, and just knowing, 5 years from now, 7 years from now, you're going to be sore. You're going to be your kidneys are going to be bad, your livers. I mean, just all the things that I know we're going to have to deal with in a few years if we don't address it now. So, yeah, I'm really excited about this. And don't forget, everybody, tomorrow, Wednesday, is National Pet Obesity Awareness Day. If you haven't already, please take the time to talk to your veterinary care providers, your team. If they can't help you, they can direct you to somebody who can. Don't try to read the pet food bags, because they're they're not designed for you to for non-veterinary people to understand them. They're just, and oftentimes they're wrong. Get your veterinary team to help you formulate a proper diet. So,
Thank you. Perfect.
all right. Thanks, Dr. Ward. Have a great day.
My pleasure. Bye, guys.